So if I did have COVID-19 in January, why did I need to get vaccinated? Or why should I have?
That's a good point. At least one article I read indicated that if your exposure to the virus itself, if you were infected, was a small viral load we mean you only got a few respiratory particles that then got into your nose and started to multiply, perpetuate, get stronger in your body. But if you got a more serious illness and your body was, extremely seriously ill, you're more likely to develop more long-standing antibodies. So the period of time for either an asymptomatic person or a person with a small viral load with very little illness might only be 3 to 6 months that the antibodies are staying with you. The vaccine itself, as Glenn was saying, we think that it's going to be, they're postulating that it might take 2 to 3 years in your body before you need a booster, if you will. So the vaccine is probably more effective than either an asymptomatic or mildly infected person at developing an immune response.
Is that why some people got COVID twice? Because that
Probably.
load was probably lower, so they just didn't have the antibodies.
Absolutely. And there have been case reports of people that do get COVID. We've been since pretty much February of last year, 2020, so now we're over a year. Yes, people have gotten COVID more than once. And some of the case reports I've read that people, especially younger people, it's worse the second time around. So the effects of the virus are worse because it's hitting the immune system harder and causing more of an inflammatory response. So in order to avoid that risk, it's even for people who have had COVID, it is worth vaccinating to develop that longer term immunity in hopes.